Hey guys, Kate here with the AAFE Med Spa. Today we are doing some twisted smooth threads on the submental region. The reason why we are doing this is we're trying to produce collagen in this area to kind of tighten this area and give it a more defined look in that jawline. So I am going ahead and placing 15 smooth threads in the submental area. I like to work in the shape of a sunrise, so you have to think your submental is a very bony portion of that area that we're treating, so we are avoiding that submental bone and muscle process in general, but we are inserting these twisted smooth threads into that mid-dermis tissue underneath the submental, and we are working all the way around from the left to the right in 180 degrees. With smooth threads, the best part about smooth threads is that you really can't mess them up. Once you do one, I tell everyone you could do 100. They typically glide like butter underneath that tissue. As you can see with these twisted threads, it is taking a little bit more oomph to get them in the tissue, but that's just because that thread is twisted around that cannula rather than just on that cannula resting. So it's just creating a little bit more trauma to that area and overall allowing that body to produce hopefully more collagen than just a regular smooth thread. So here I am inserting these smooth threads at a 45-degree angle into the tissue. Once that pops through the initial tissue and you're in that mid-dermis, you're going to level off, push the rest of that smooth thread in, and then once you are past that thread or that marshmallow, you're going to twist 360 and come all the way out. I tell everyone your preferred depth is going to be wanting to see that cannula move underneath that tissue, but you're never going to want to see the coloration of that cannula. So be mindful of that you're not too deep or not too superficial, because you obviously want to get the best results as possible and build the most collagen. Afterwards, I'm just applying some arnica for any swelling and bruising, and I'm just telling the patient to keep the area clean.